you might remember me from before, but in case you don't, I am the charge nurse, Nurse Visa, and I'm in charge of all the IVs on the floor, so I'll be doing yours today. Just pick an arm. You can also call me Telly, and I'm out visiting today. So my name is Telly, and this is Annette. Perhaps you've seen Annette before. It's her first day. You might be more commonly familiar with her. If I put a bunch of Jell-O in there, then I'd have Annette full of Jell-O. Anyhow, I thought I'd give you your medical lesson for today because you don't want those nurses to think you're not as smart as them. So I'm going to teach you some medical terms, and you can just tell the nurses if they say anything about bacteria. You say, oh, I know what that is. That's the back door to the cafeteria. Or if they say something was in your artery, you go, oh, of course. That's where they're going to hang all my artwork I'm going to do in rehab. And if they say anything about nitrates are off, you say, oh, I know what that is. They're cheaper than day rates. Or if they say benign, you go, that's easy. That's what you be after you're 8. You be 9. Anyhow, I just want to tell you that you are the bravest person I know, and I'm so proud of you, and I hope to be half as good when I grow up as you are. And I hope you have an easy recovery, and I know you're going to do well because you're a fighter, like me. Anyhow, you know, while you're sitting there, I know you're not feeling sorry for yourself, but you're not the only one who's sick. I have a disease too, and at least they could do something for yours because there's nothing they could do for mine. I have that furniture disease, you know, the one where your chest falls into your drawers. There's no cure. Anyhow, I do have a couple of friends in the hospital besides you. I have a friend who's got an addiction to brake fluid. We all know somebody who has an addiction, so he drinks a lot of brake fluid. But he says he could stop at any time. I have another friend who's in the hospital. He swallowed a ton of quarters, and I keep checking on him, but there's no change. Anyhow, maybe I should move on to magic because you think I'm just a pretty face. Oh, by the way, I get a lot of requests for people to look like me. So I have a 2 o'clock appointment tomorrow. I could come up and do your hair and you could look just like me. But anyhow, maybe we should just do some magic. So my first magic trick is I can make a scarf disappear. I don't do patients anymore because I have a hard time getting them back and the nurses get upset, so I just do scarves. So if I put it in my hand, and if you're real good, I'll show you how I do the trick, okay? So I put it in my hand and I stick it in there real good, and if we've got a magic word, I can't do my wand because I can't do everything, so let's make roar the magic word of the day. Okay, so we will say roar, and bam, the scarf is all gone. So I bet you're wondering where it is. Well, it's in my hand. Now the hard part is getting it back, but I can do that. So if you watch real carefully, I will get it out of my hand. And here is my scarf. So I bet you're wondering how I did that. So I'll show you, because all magicians have what they call a thumb. So then they would put the thumb in their hand, and then they would put the scarf in the thumb, like so, and then abracadabra, scarf is gone, and it's in the thumb. Oh, but it's not in the thumb. I guess I can't tell you everything, or if I tell you my tricks, I'll have to kill you. All right, let's see what else we can do. Oh, I know what I can do. I have a little ball. I make that disappear too. So this time I could get my magic wand and we can say our magic word, roar. And let's see. Hey, where'd it go? I didn't see it go anywhere. Did you see it? I don't know if I can get it back. I was just sent down to keep an eye on you, but I hope you are watching carefully because I will try and get the ball back. So let's say our magic word, roar. let's see. It's still not back. Oh my gosh, that didn't work too good. You're gonna have to roar louder. Ready? Roar! Oh, there it is. I got it back after all. Okay, so what else are we gonna do? Oh, here I have a cute little trick. I have my magic little bag, and it's empty, but I'll show you that it's empty. So, see, my bag is all empty. Ooh, nothing in there. So, I'm gonna do the old trick of the 2 ropes in the bag. And I'm going to do that old clown trick where they get tied in the middle. So I put my 2 ropes in, and we do abracadabra, and guess what? They're tied in the middle. Pretty good, huh? I practiced that a long time. Okay, I have one more trick for you because this is like a premier clown trick. So I went shopping the other day and I could not find anything to buy. So my bag is empty. But if I look really hard, and maybe if you said a magic word, I could find something in my bag. Wow. It's still empty. It's still empty. I'm not sure how high it has to be for you to see it. But if we say our other magic word, roar, I think we could find something else in our bag. Oh, somehow there's something else in here. I promise I did pay for it while I was shopping. I don't know how that got in there. But it's still empty. So maybe if we say our magic word, roar, again, we got something else. You thought we were just pretty faces. Anyhow, Miriam, if you enjoyed our little chat, I don't know if you could see my button, but my suggested chip is $2,630.75. But don't worry, you don't have to give that much. You could give more. Anyhow, I just wanted to say that I'm very proud of you, and I'm thinking of you, and I'm pulling for you, and you will be fine. And thanks for listening. Come back anytime.